A new study out today suggests women with dense breast tissue could benefit from an MRI in addition to their annual mammograms.
Doctors say the additional screening could save more lives, but it also comes with some risk. Circle of Health reporter Denise Dador joins us in studio with a closer look at the study and where it could change how some women are screened for breast cancer.
Right, and this affects so many women. If you get screening mammograms and you have dense breasts, it's likely you received a letter from your provider informing you of your condition. But what are you supposed to do with that information? New research hopes to give women a course of action.
When a doctor looks at a mammogram, there are no gray areas.
On x-rays, fibroglandular tissue looks white and fat is black. The more white on the x-ray, the higher the density.
That's why women with dense breast tissue pose a challenge to radiologists.
Breast cancers also appear as white on the mammogram.
Dr. Jason McKellop, director of breast imaging at RadNet and Breastlink, says half of women have dense breasts. Not only are their mammograms more challenging to read, breast density leads to a slightly higher risk of breast cancer. So should these women undergo additional screening? A new study looked at the pros and cons of these women getting supplemental breast MRIs.
Breast MRI is the most sophisticated and most sensitive imaging utility that we have in our entire arsenal of imaging.
In a new JAMA Internal Medicine study, researchers estimate current mammography guidelines can save 7 to 11 lives per 1,000 women. They found supplementing with breast MRIs could save an additional life, resulting in 10% more lives saved.
There's a significant uptick in cancers detected as we expect.
But widespread MRIs came at an increased risk of 40 to 80% more false positives, which can be stressful, time-consuming, and lead to expensive, unnecessary testing, including biopsies.
We would be scrutinizing a lot more benign things than we otherwise would be.
While researchers support additional screening, Dr. McKellop says women should ask their doctors, do I have dense breasts? Do you recommend additional screenings? And what is my personal risk of breast cancer? One screening Dr. McKellop recommends for women with dense breasts is a breast ultrasound in addition to yearly mammograms.
Breast ultrasound is a handheld unit, readily available, very cost effective.
So the bottom line, women don't have to necessarily stop at a yearly mammogram. Talk to your doctor about what additional screenings would be right for you. In the meantime, the issue of all women getting breast MRIs will continue to be studied. But an ultrasound, that's something Dr. McKellop says is usually covered for women with dense breasts.
Yeah, it's good information to know, Denise. Thank you. Thank you.
Very smart doctor, too.
Thank you.